Shiatsu is a Japanese healing art based on concepts of energy, movement, and health that began their evolution in the Orient over 5,000 years ago. Shiatsu in Japanese means finger pressure, precise, comfortable pressure applied to all parts of the body, effectively balancing body and mind and triggering our own natural healing power. According to Oriental medicine, good health and strong healing powers depend on the smooth flow of life energy, or ki, to all parts of the body-mind. Disease, discomfort, fatigue, or emotional distress can all occur when this free flow of ki is interrupted. Shiatsu seeks to balance this flow using only hand touch. Our particular approach, Meridian Shiatsu, is based on the teachings of Shizuto Masanaga and Kaz Kamiya. Kamiya sensei believes that everyone has healing hands and the ability to feel disharmony in the body, especially when you are relaxed and centered. Furthermore, when you study with an experienced instructor, your sensibility will improve greatly, and you will be able to tell more about your partner more clearly and more quickly. In Meridian Shiatsu, we look for distortions in the flow of ki throughout the entire person as well as at local reacting points. This pattern of distortion is called sho in Japanese, and kyo and jitsu are the terms used to describe sho. Kyo describes a condition of deficiency, a lack of ki. Jitsu describes a condition of excess, too much ki. In this video, Kaz Kamiya demonstrates a full-body, free-form Meridian Shiatsu treatment that incorporates various techniques of pressure and stretching to show the many possible ways of manipulating the body. Many of the techniques shown in this video are advanced techniques that the beginner should not do, since Shiatsu that is improperly applied can have harmful effects. Shiatsu applied with skill, care, and an understanding of Oriental philosophy is a wonderful way to restore balance, harmony, and peace to one's life. Shiatsu therapists begin a treatment by gently palpating the abdomen, or hara, regarded by the Japanese as the energetic center of the body-mind. The subtle variances found here provide information about the functioning of the body-mind to guide your treatment. Face up, hara. Initial contact. Now loosening the abdomen, or as the Japanese call it, the hara. With your left hand providing firm support at your partner's waist, with your right hand apply gentle palm pressure, first just below the sternum, then over the navel, and then above the pubic bone. To your partner's left side, apply pressure just under the rib cage and above the hip bone. Repeat on the right side. Using your sensitivity and intuition with basic technique, comparing and contrasting the different organ reflex areas. Using 3 fingers, apply pressure in the solar plexus to the heart, heart constrictor. On the left side under the ribs, stomach, triple heater, lung. On the right side under the ribs, gallbladder, liver, lung. Below the navel, spleen, kidney, bladder. On the left side above the hip bone, large intestine and small intestine. Repeat large intestine and small intestine to the right side. In Shiatsu, diagnosis is treatment and treatment is diagnosis. By applying pressure to the reflex areas, we directly affect the functions of the specific organs. The hara is a place where all energy and motion within us begins and where it ends. The navel area, the area of the spleen and kidney, often stiff, so we can give extra treatment here to loosen it. Then we apply the wave on upper and lower abdomen as a finishing balancing technique. Prepare now to compare what we found on the hara with the condition of the meridians throughout the body. Cross palm 2 breaths. Sitting position is very important and useful. You can naturally observe and assess the condition of your partner, and you can treat the major distortions right at the beginning. In Shiatsu, we treat the same key places in the body in different positions over a period of time. This gives a comfortable, progressive depth to your treatment. Sitting position. Pressing the spine, this is a good location for evaluating your partner's show. A busy network of meridians intersects at the top of the shoulder along the spine. Like the hara, the back consists of reflex areas. Examine and treat each area thoroughly, using all the advantages of thumb, knuckle, and elbow technique. Reading the body's signals, like Braille, reading tension, tightness, hardness, softness, looseness, pressure pain, indentations in the layers of muscle which protect the internal organs. Alternating thumb pressure from right to left directly beside the spine. Slumping or an inability to straighten at a certain level of the spine may be due to trouble in associated organs. A high shoulder may indicate a jitsu condition in one or more organs on that side. A low shoulder reflects a kyo condition. Now to the right side. Feel for resistance. Note differences between the right and left sides. Overall, you hope for elasticity and flexibility, signs of life. Flexibility indicates healthy functioning of the body and mind. Sitting position clearly reveals imbalances in the body. Hold your partner's wrist in your left hand, while right hand thumbs along the triple heater meridian. Make sure you have a good knee support to provide a comfortable position for your partner. You'll be surprised to discover how much tension accumulates here. Working the arms helps increase the circulation of blood and energy to the peripheries. It opens the brachial arteries to help reduce high blood pressure, loosen tense muscles, and compress joints to increase neck, shoulder, elbow, and wrist mobility. It also alleviates compartment and entrapment syndromes, which constrict nerve pathways and lead to pain, pins and needles, or absence of sensation. Now press between the metacarpals. Then press and pull fingers starting with the thumb on top and sides of joints. Joints require detailed treatment with good holding in order to release the tension that accumulates easily in the extremities. The extremities are where the meridians end and begin. After applying pressure, stretch through flexion and extension to help to open the joint and normalize energy flow in the meridians. Gentle shoulder rotations. Support behind the shoulder with your right hand, left hand below elbow guides. You may feel points of subtle resistance. In Meridian Shiatsu, pressure and stretching are used to complement and enhance one another. Right arm. Repeat the same sequence. Pay special attention to sensitive areas. Note how the right side and left side differ. Pressure should always be firm but comfortable, never causing undue pain. The body must always be well supported, either with your hand or with another part of your body. Your partner's posture should be straight, relaxed, and comfortable, with good support from the therapist. Shiatsu to the neck. Here the therapist supports his partner's shoulder with his left hand while using his right hand to treat the appropriate meridians: stomach meridian, small intestine meridian, and bladder meridian. Repeat on the right side. Head extends, fingers at base of skull. Gentle head rotations to the right side and then to the left side. Stretching upward, both thumbs at base of skull. Fingers placed firmly but gently on the temples. Returning to the top of the shoulder, use thumb and elbow pressure on the 3 yang meridians: gallbladder, triple heater, small intestine, which often require sedation. Flat elbow on the lung point on the pectoralis major is excellent for lung conditions such as chronic bronchitis, asthma, and colds. Repeat with elbow on right shoulder and lung 1. Stretch arms upward, support your partner's back with your knee, allow arms to bend at elbow, pull back, open chest. For full spinal extension, pull back smoothly, firmly, unfolding your partner into a full spinal extension. This is an advanced technique and should be practiced on a limber individual. Use a pillow for a comfortable stretch. Spinal flexing. Bend your partner's head forward. Support her elbow and shoulder. Guide her to the right, giving the spine a gentle, effective stretch. Repeat on the left side. For shoulder shrugs, grasp both arms at the shoulder, lift and let drop. Finish with a brush down the back. Side position is the next step in deepening the relaxation. It is a very good position in which to treat small details on the head, neck, shoulders, arms, back, and legs, both with pressure and with movement and stretching. It is the major treatment position for pregnant women or anyone else who has difficulty lying on their stomach. Kneel comfortably above your partner, palm down on the side of her head. The gallbladder and triple heater meridians occupy much of this area. Press on 2 lines around the ear. Pull down on the shoulder, leaning back to see the sky, gently stretching all meridians in the neck. Now prepare for neck shiatsu. Always keep in mind that the neck is a very delicate and sensitive area. Here we treat 3 major meridians: stomach, small intestine, and bladder. First line is just in front of the thick sternocleidoid mastoid muscle. Second line is just posterior to the SCM. Stiffness and sensitivity are common here due to physical and emotional stress. Third line follows the bladder meridian. Once again, apply pressure to 3 points at the base of the skull. Apply thumb shiatsu along the top of the shoulder from the base of neck. Five points along the interscapular region. Shoulder stiffness arises for many reasons. People with heart disease, high blood pressure, or with problems in internal organs such as the stomach, intestines, or female organs often experience it. Now applying 3-finger pressure along the spine, work the first line of the bladder. It is easiest to divide the back into 2 sections. Apply stable, comfortable pressure with the tips of your fingers close to the spine. When palming the arm, remember that the meridians connect up with the neck and shoulder areas. Position yourself perpendicular to your partner, knees shoulder width apart. Treating the effective meridians on the arms is beneficial for neck and shoulder problems. Squeeze along the arm. Apply elbow shiatsu. Also apply palm and thumb. Pull arm down and up, stretching the arm, down towards the feet and then over the head. Rotate the arm while supporting the shoulder. Now bring the arm above the ear and rest it gently on your partner's head. Support elbow with your palm. Apply firm, gentle palm pressure from armpit to elbow using both palm and elbow pressure. Open the chest. Sit parallel to your partner to provide support and raise her arm to stretch and reach lung 1. Now shoulder rotations. Push towards the ear and away from the ear. Rotate clockwise, counterclockwise. This both tests and increases the full range of shoulder mobility. Chicken wing. Loosening the bladder, small intestine, and triple heater meridians. Starting at the armpit, apply gentle, rhythmic pressure to loosen the area between each rib. This assists respiratory functions and relieves intercostal nerve pain. Once below the ribs, apply deep pressure to 3 points along the iliac crest. These points are effective for intestinal problems such as constipation and for menstrual pain. To treat the sacrum, face your partner's feet, palm shiatsu along the edge of the sacrum, following the bladder meridian. Now above the trochanter at the hip, change your position again to face your partner. Press from hip joint to waist, first using palm, then elbow. The side of the thigh along the gallbladder meridian is very sensitive for most people. Be sure both legs are comfortably positioned. Use your right hand to stabilize the hip joint above the trochanter. Apply gentle palm pressure, then elbow pressure, loosening the iliotibial tract, hip, and knee. You can also work triple heater meridian to the front. And large intestine to the back, depending on needs of your partner. Now stabilize the knee joint and press with palm and elbow from knee to ankle along the different meridians. Press the heel bone, and below it, Ringkyo gallbladder 41. Next, palm shiatsu, tracing the yin meridians of the inner thigh and the often tight abductor muscles which attach superiorly in the region of the pubic bone and inferiorly to the femur and tibia. You can also use elbow and knee pressure on the important treatment areas. Pressure should always be comfortable, as the inner leg is usually sensitive. 3 lines should be treated. Now apply palm, elbow, and thumb pressure to the meridian of the lower leg. Also, apply pressure to the heel. Finally, after loosening up all joints of the hip, knee, and ankle, apply the rainbow stretch for mobility and to realign the joints. Refer to your manual for instructions on how to do this stretch properly. Brush down along the spine. Ask your partner to turn to the other side. Left side down. Palm pressure to the side of the head, reassuring your partner. Thumb shiatsu along triple heater and gallbladder meridians. Visualize their pathways around the ear. Pull shoulder back. Neck shiatsu. The neck is a small area but contains major nerves and arteries that go to the brain. Treatment to the stomach meridian at the front of the neck affects the carotid artery and the vagus nerve, affecting the parasympathetic nervous system, which controls internal organs. Treat here carefully but well. The bladder meridian is often affected if the person suffers from arthritis or whiplash. There are 3 essential points at the base of the skull. These points are very important for treatment and well worth spending some time on to release tension. Elbow pressure can be used to give longer holding. Top of the shoulder. These points, along with the 5 points along the inside of the shoulder blade, are very effective in relieving pain caused by tension in the shoulder, neck, and upper arm. Interscapular region. With fingers facing in front, concentrate on key areas while applying thumb and finger pressure. 3 fingers pressing along the spine enables you to feel distortions that need special attention. We can also use elbow on bladder 1 and bladder 2 in side position. This is especially useful if you are treating someone who has difficulty lying face down or someone who is particularly tense. As you elbow along the arm, feel for key treatment areas along the meridians and apply pressure to these areas. When you apply elbow pressure, you can give long holding with precise, comfortable pressure. Turn palm up to reach the inside areas of the arm. As you pull the arm down and up, make it a gentle, continuous, and comfortable stretch. Shoulder exercise maintains and increases joint mobility. Make sure all movements are natural, not forced, and within your partner's range of motion. Applying elbow pressure around the armpit will help to loosen shoulder tension. Spend time on lung 1 using elbow if stiffness and pain are present. This will benefit the body greatly. Shoulder rotations. Chicken wing. Apply comfortable pressure between the ribs with the elbow. Besides intestinal problems, this treatment area is effective for pain caused by distortions of the lower lumbar spine. Firm, deep pressure along the sacrum is beneficial for a number of discomforts such as low back pain and female reproductive disorders. Elbow along the trochanter. A lot of tension and stiffness can be found on the gallbladder meridian. Take the time to apply pressure not only to the gallbladder, triple heater, and large intestine meridians, but also to the stomach meridian in front of the thigh. And bladder meridian along the center. Knee treatment can be applied here. Use palm or elbow along the lower leg, while your upper hand supports the knee. You can work a number of meridians in this area. Press the heel and gallbladder 41. Push upper leg forward, apply Shiatsu from ischium to knee. Lower elbow supporting below the knee. Knee pressure is very effective in improving circulation in this area and throughout the body. You can use knee pressure to reach the deeper treatment areas, but be sure your partner is comfortable and well supported. Apply palm, thumb, or elbow pressure to the lower leg. Press the heel bone. Treatment in this area is especially beneficial for low back pain. Complete the sequence with the rainbow stretch, which will realign body structures and improve the circulation of ki. Finish with a brush down the back. By this point, major distortions have already been released. Face down is a major treatment position for your partner. It is the most relaxed position. The therapist can concentrate on the major treatment areas that show more readily in this position. It is important that your partner is comfortable. Use pillow under the chest and legs if needed to ensure good body contact and that there is no strain on the neck. Thumb pressure to the back of the head from the crown of the head to the base of the skull. This is the governing vessel. Then on both sides of the governing vessel, work the bladder meridians. Pressure to the medulla oblongata activates the autonomic nervous system. 3 points at the base of skull, bladder 10 and gallbladder 12 and 20. Finish loosening the neck with deep and shallow, gentle grasping. With arms placed at 90 degrees, palm Shiatsu from shoulder to elbow along the meridians flowing from the neck. Pull shoulder down, remove pillow. The ritual brushing down confirms the connection between you and your partner and prepares her for what follows. In face-down treatment, like Hara treatment, it is important to coordinate your pressure with the out-breath of your partner. There are reflex areas along the spine, and chronic conditions tend to show most clearly here. Checking the spine, one hand active and the other supporting. Press center, right, and left side of the spine. Feel for resistance, spinal deviation, pain, discomfort. Such areas may indicate a problem with the spinal structure itself or the nerves it protects, or it may reflect the condition of a particular internal organ. Sitting to the left side of your partner, apply single elbow pressure, first to the left side of the spine, then to the right side. Search for those areas which most require energy balancing. The most depleted or kyo areas must be tonified through deep holding pressure. Excess energy or jitsu areas must be sedated through lighter stimulation. Divide the back into 2. Remain seated on the same side to apply pressure to the right side. Besides just working the first bladder line, spend time working the second bladder line and the third one. You can also use the double elbow technique to work the bladder meridians. Use a combination of techniques to give good, long holding to the important treatment areas. The application of pressure in Shiatsu follows 3 major principles. Holding pressure is unique to Shiatsu. By holding a point for 2 to 7 seconds, or sometimes longer, we give just the right stimulus to the body to disperse the jitsu or to tonify the kyo. Holding pressure penetrates the body, inducing a deep relaxation. Vertical pressure ensures that your pressure doesn't slide the skin and that your contact is direct and comfortable. Support and concentration allow your partner to accept your pressure with trust. Pressure is never applied with muscular force. We use our natural body weight that we call lean-on pressure. This pressure is comfortable for both giver and receiver. It is not tiring and penetrates deeply. Elbow pressure is very effective for the points just above the crest of the hip, as you will find the energy stagnates easily here. Now the sacrum, the triangular bone at the base of the spine. We treat 3 lines following the path of the bladder meridian. Apply thumb shiatsu on the first line, 4 points to feel the foramina, or nerve exit roots of the sacrum. These points are often sensitive. The second line follows the outer border of the sacrum. The therapist positions himself perpendicular to his partner for the 4 points of the third line, which travels a more fleshy route from the top edge of the sacrum to just above the hip joint. You can also treat the sacrum with elbow pressure. Your treatment now follows the bladder meridian down the back of the thigh from the ischium to the knee, where you find the bulky hamstring muscles using palm, thumb, and knee pressure. You can reach inside the thigh by bending your partner's knee outward, keeping it supported. Observe: lean on pressure, vertical pressure, supporting pressure, holding pressure, and appropriate pressure. Your hand supports the sacrum as you first apply palm along the inner thigh and then the elbow, concentrating on finding the most effective treatment points. Crease of the knee. The therapist supports the partner's lower leg against his thigh. Use caution. The many ligaments here are very sensitive. Using palm or elbow along the calf, these bladder meridian points can be extremely sensitive and are effective treatment points for low back pain, cramps in lower leg, knee pain, and sciatica. The stomach meridian is best reached by bending the knee of your partner. You can also use double thumb pressure and knee pressure. Treating points on the sole of the foot with elbow pressure has an excellent effect on the whole body. Do Shiatsu between the metatarsals. Press and pull the toes. Ankle exercise. To loosen the many tendons and ligaments that must bear the body's weight, rotate clockwise and counterclockwise. Pressing the heel to the buttocks tests and increases the flexibility of the quadriceps muscles of the anterior thigh. Move to the right side and begin at the sacrum. Pressure to the sacrum brings a lot of relief, as shown by your partner's deeper, slower pattern of breathing. Elbow pressure relieves the deeper layers of tension within the muscles because you can hold a comfortable pressure for a longer period of time. Remember when applying pressure to the thigh to apply appropriate pressure that will affect the body internally. Be sensitive to your partner's condition. Treating the meridians on either side of the bladder meridian, liver on the inside, and Masanaga's large intestine meridian on the outside will promote a deeper state of relaxation. Supporting the sides of the knee joint with 4 fingers, thumb on thumb shiatsu from center to each side. Be sensitive to your partner's body. Her reaction will tell you if you are applying comfortable pressure. Sensitive areas of the calf must be treated cautiously. so as not to cause the body to tense up in defense. We also treat the stomach meridian with the knee, paying special attention to stomach 36, a very effective point for overall body conditioning. Working the sole of the foot and between the metatarsals and the toes is pleasurable and stimulates the beginning and ending points of the meridians. Occupational lifestyle habits often subject feet to soreness and aching. Rotate the ankles to improve joint movement and reduce stagnation that leads to pain and stiffness. Dorsiflex the ankle, heels to buttock. Pull the leg back. After both sides are finished, face away from your partner, stand with your heels on the soles of their feet. Shift weight alternately on each foot. Use caution here. Then walk on the inner calves. Knees to ischium. Press in the intestinal region and along the sacrum. Now positioning yourself above your partner's head, apply thumb shiatsu to the interscapular region. Apply elbow pressure to points on the bladder meridian adjacent to the first 3 thoracic vertebrae and 1 point at top of the shoulder on the left side. Repeat on the right side. Walk down the arms. End by brushing down. Face up is the finishing position. The major treatment has been done. Your partner is fully relaxed. We treat legs, arms, neck, head, and face with pressure and stretching to work out the final distortions. A final check of the hara completes the treatment. Face up position. Loosening the hara. Checking again for changes in show. Ki flows from the hara to the peripheries. With the therapist now positioned perpendicular to his partner, waves, loosening the hara, the source of ki. Left hand supporting right hand, rhythmically undulate the hara forward, then slowly back, using all fingers of both hands. The therapist begins applying pressure along the lateral muscle of the quadriceps group. Trace the stomach meridian from growing to knee. Opening up the meridians which flow downward from the hara is extremely important. Stagnation here can either be the cause or effect of poor energy flow in the hara. The whole person is affected. To find the small intestine meridian along the inner thigh between the quadriceps and the adductor muscles of the leg, bring your partner's right heel to her left knee. If there is a lot of tension here, don't force the knee to the floor. With continuous shiatsu to the hara and to the meridians of the leg, you will gradually increase your partner's flexibility. Use knuckle pressure and 3-finger pressure as well, working growing to knee, and knee to ankle. With your left palm still supporting the abdomen and your right medial knee supporting your partner's knee, elbow along gallbladder from trochanter to knee. By changing the position of the leg, you can reach all the meridians. At the back of the thigh is the bladder meridian. Use firm, deep pressure with elbow and knee. Now to stretch the stomach meridian. Carefully bend your partner's leg fully so that the sole of her foot touches her buttock. Now to the left leg. Use palm and elbow along the stomach meridian on the top of the thigh. Inside the thigh, press the knee down to check flexibility. Often in women, tension in small intestine meridian indicates stress on the reproductive functions. Apply thumb shiatsu to lower leg. Trace along the iliotibial band with the elbow, the gallbladder meridian. Apply elbow pressure to the bladder meridian behind the thigh. Stomach meridian stretch. This is the knee to chest exercise. Rotate to the right and left. Side stretching brings the gallbladder meridians into play. Stretch to the left first and then to the right. Knees to chest. The deep abdomen stretch. This technique is excellent for adjusting distortions of the spine and relieving chronic low backache. The therapist supports the weight of his partner's leg on his right shoulder, His palm is placed firmly on the area of the hara corresponding to the distorted area on the back. Be careful not to push down suddenly. Bend the knees again and apply adjusting pressure as you rotate the hips in a small circle. Press down. Arm Shiatsu. Work on the right arm first. Palm up to treat the vital heart meridian. Support the arm below the elbow with your left hand. Palm Shiatsu from shoulder to elbow. Then supporting above the elbow with your right hand, palm with your left hand to the wrist. Also use elbow pressure. You can work all the meridians on the arm. Turn palms down and apply Shiatsu to the other side. Hands. The therapist's fingers are hooked into the thumb and small finger of his partner. Stretch the palm open, apply deep pressure to 3 points. Now, the dorsum of the hand. Concentrate on the points in the web between thumb and forefinger. Continue pressing between each metacarpal. Press and pull fingers on top and sides of joint. Shoulder rotation. Arm exercise. Pull arm down. Repeat on left arm. Apply elbow shiatsu in the shoulder groove separating the deltoid and pectoralis major muscles and follow along the inner arm. Turn palm down, repeat. Sometimes you need to change your position in order to reach a particular meridian more easily. Stretch the wrist joint. Arm exercise. Move up to the neck. Start with neck rolls. With 4 fingers on each side of the spine, lift and pull the neck on 3 points, from the 7th to the 3rd cervical vertebrae. Apply thumb pressure along the neck to appropriate points and meridians. Take note of areas of tension and sensitivity on the neck. Repeat on the right side. Stretch the neck. Gently to the right, to the left, and then to the center. The head. Thumb on thumb shiatsu along the center line of the scalp, from the hairline to the crown, 5 points along the governing vessel meridian, 5 points again on either side of the center line, the bladder meridian. Follow with points on the forehead, 3 points from between eyebrows to hairline, 4 points on eyebrows to end at the temples. Below the eyes, gently here, 4 points. Sides of the nose, 3 points, effective for headaches, sinus congestion, radiating toothaches. Underneath the cheekbones. Apply pressure between nose and lips. Under chin, lift and squeeze. Massage the masseter muscles. Press and pull the ears. The temples. Massage clockwise and counterclockwise. Cup the eyes to give them a true rest. Open chest. Apply thumb pressure to 3 lines, working between the ribs from the center outward. Work carefully with hand weight as not to break the ribs. Apply gentle pressure to the sternum. Massage the pectoral muscles cautiously with relaxed hands. Open chest. Arm walking. With palms, lean and alternately grasp the right and left arm, moving from shoulder to elbow. Bring both wrists to your knee, lean back and stretch. Pull arms up alternately and release arms gently. Go to the feet. Press between the metatarsals. Pull toes. Brush toes. Dorsiflex, plantar flex. Repeat on the right side. Press feet down. Walking upward. Check the kneecaps. Loosening the hips. A final adjustment to the body. Hands underneath waist, fingertips lift up. Squeeze the abdomen. Open the chest. Return to the hara, full circle, drawing the healing energy back quietly to the center.